In last week's video, we talked a lot about cervical whiplash. Today, let's talk about lumbar spine whiplash. Whiplash actually of the low back. This is a very overlooked area when it comes to motor vehicle accident. Everyone wants to look at the neck, right? Because the neck's not in a fixed position. But a lot of times the lumbar spine is involved also. So this is definitely an area we want to keep in mind when we're doing our exams for these motor vehicle accidents. And again, a lot of times we'll see these patients 2 or 3 days after they were in an accident. And these injuries, these symptoms may take 4 to 6 days to present themselves, right? So definitely something we want to keep in mind when it comes to lumbar spine injuries related to motor vehicle accidents. The same thing kind of applies for the lumbar spine as it did in the neck, though, right? So it's still an injury to a ligament of the spine. We're just dealing with a different area of the body, right? There's different forces and different stabilizing mechanisms like a seatbelt across the lap that come into play here, right? And can help not only cause sprain of the surrounding supportive structures, the ligaments of the spine, but also a strain of the surrounding musculature of the area. So let's show you a quick way that we establish the integrity of the lumbar spine on a physical exam when we deal with a patient following a motor vehicle accident. All right, so we've established that the patient probably has some sort of whiplash injury related to the lumbar spine, the low back. Let's show you how we evaluate that. Same idea and principles as we used last week in the cervical spine injury whiplash video. This week we're going to just do that in the lumbar spine. Okay, so we're going to have the patient cross their arms over their chest. This way we isolate the low back. We'll have them run through an active range of motion to test the muscular system. So go ahead and bend forward for me. You could go ahead and extend back. Meanwhile, I'm just looking to see, is she extending and flexing through the lumbar spine? Is there pain at end range? These are all the things I'm looking at here. Good. A decrease in range of motion here, pain at end range may indicate some sort of muscular injury, right? Some sort of muscular strain is the diagnostic terms we use here, right? Now what we'll do is what's called a passive range of motion, okay? So again, same thing as last week. We'll have the patient nice and relaxed, and the practitioner will run the patient through those same ranges of motion. Pain at end range here is a very good indicator of some sort of ligamentous injury, okay? And again, when I say pain, it's not like day-rooting pain. It's just like a little bit of discomfort, or like, it kind of brings the symptoms that you're used to feeling to the surface. We're not trying to hurt our patients, right? Another thing we could do here too is check the neural tension, right? So we talked about that last week with the cervical spine when we put the nerve on tension. We'll do the same thing here with the big nerve in the lower body called the sciatic nerve. So we'll have the patient cross hands over the chest. We'll have them look down at their belly button, flex forward as far as you can, and then just go ahead and bring your left leg and toes to the ceiling. That puts that nerve fully on tension. If they have some sort of sciatica or radiculopathy, that will light it up. Let's go do that on the other side. Good. Great. A lot of times what we'll do too is we'll start to, this is just kind of a very basic exam. So what we'll do is we'll start to evaluate any other injuries. Maybe the patient has a little bit of hip discomfort, or back to the cervical spine, some shoulder discomfort, right? So these are the things that will kind of tailor to the individual case. But this is the very generic view of what an exam looks like from a lumbar spine whiplash injury. And remember, the 105 days that we talked about in the last video, current research shows it takes about 105 days for you to turn to pre-accident status after a motor vehicle accident, right? And that timeline we talked about, similar to a sprained ankle, where that first month is very painful. Maybe the next 2 months aren't so bad, but there's still some level of underlying discomfort and a higher risk of re-injury. So keep that in mind. If you've been in a motor vehicle accident, I highly recommend that you get checked out by a professional.